Welcome back guys. We are discussing about the basics in the renal physiology. So far what we have seen renal plasma flow which is somewhere around 625 ml per minute and that is estimated by para-aminohippuric acid. We have also seen what is the normal blood flow. Normal blood flow is 1200 ml per minute and what is the normal GFR guys? It is 125 ml per minute, and I have also said you that GFR or clearance of any substance is measured by using creatinine as a marker. Okay, creatinine or inulin are the markers which are used for estimation of the GFR. Normal GFR is, again I am repeating, 125 ml and normal plasma flow is 625 ml. Plasma flow is, renal plasma flow is estimated by using para-aminohippuric acid. Now let's continue with the parts of nephron. You guys have already know it, but for the sake of completion purpose, I am just telling you. Sir, if you look here, guys, the blood vessel which is bringing the blood to the nephron for the process of filtration, that blood vessel, see this blood vessel is known as afferent arteriole. So afferent means arriving. So that blood vessel which brings the blood to the nephron for the process of filtration is known as afferent arteriole. Now this afferent arteriole is going into this body which is known as glomeruloid body. Now in this area, this afferent arteriole is going to divide into small capillaries. So these capillaries are known as glomerular capillaries. So afferent arteriole will divide into glomerular capillaries, and all those glomerular capillaries, they will fuse, and from here the blood is going to go back into the systemic circulation with the help of efferent arteriole. Efferent means exit. So the one which brings the blood is the afferent arteriole. Now blood from afferent arteriole is going to enter into the glomerular capillaries, and this is the place where filtration occurs. We will discuss how filtration occurs, but see, after filtration, some of the leftover blood is going to go back to the systemic circulation with the help of efferent arteriole. And this structure, whatever you are seeing here, this one is the Bowman's capsule, the first part of nephron. Okay, Bowman's capsule is a capsule-like structure where you are having a glomerular capillaries. Now, after this Bowman's capsule, this first area, okay, this area of the nephron is known as proximal convoluted tubule. It is proximal in nature. Okay, it's the first part, right? So proximal convoluted tubule is there. Okay, this is all proximal convoluted tubule. Following the proximal convoluted tubule, you are going to have this structure which is known as loop of Henle. So whatever I am highlighting here is the loop of Henle. How many parts of loop of Henle are there? See, this is descending part, so I can call this as the descending limb of loop of Henle, and this is the hairpin turn, okay, and this is ascending part. So this is ascending limb of loop of Henle. So for what we have seen, Bowman's capsule, proximal convoluted tubule, descending limb of loop of Henle, hairpin turn, and ascending limb of loop of Henle. Now from here, this urinary ultrafiltrate is going to enter into this area. This area is known as distal convoluted tubule. Okay, this is the distal convoluted tubule. The proximal convoluted tubule is there as well as the distal convoluted tubule is there. Now this distal convoluted tubule is going to end as the collecting tubules. Okay, collecting tubules. So these are the parts of nephron: Bowman's capsule, proximal convoluted tubule, descending limb of loop of Henle, hairpin turn, ascending limb of loop of Henle, distal convoluted tubule, and collecting tubules. So these are the parts of nephron. Now let's see two different types of nephrons. What are exactly two different types of nephrons and their function? Those nephrons which are present in the cortex region. Okay, so we know that in the kidney we are having two regions, cortex and medulla. Okay, cortex is the outermost part, the peripheral part, and the medulla is something which is present deep. So those nephrons which are present in the cortex, okay, these nephrons which are present in the cortex, they are known as the cortical nephrons. But there are certain nephrons which are very least in number, almost just 15%. Now these nephrons are present in the junction of cortex and medulla. So we can call them as juxtamedullary nephrons. So in the name itself it's very clear, juxtamedullary. Juxta means what? Simply side to the medulla or near to the medulla, whatever the nephrons are there, you can call them as juxtamedullary nephrons. Now, how many types of nephrons are there? Two types. What are they? Cortical nephrons, Juxtamedullary nephrons. Who are more in number? Cortical nephrons are more in number. They account for almost 80% of the nephrons. If you look here, cortical nephrons, they are more in number. How many? 80 to 85% of the nephrons are cortical nephrons, and 15 to 20% of the nephrons are juxtamedullary nephrons. Now, what is the importance of this cortical and juxtamedullary nephrons? See, now these cortical nephrons, they are helping in the formation of urine. Okay, mainly urine formation is done by cortical nephrons. But in certain conditions where you are getting dehydrated, in those conditions the urine need to be concentrated. You should not just leave the diluted urine. Okay, you should not excrete diluted urine in certain conditions, especially when you are getting dehydrated. So in dehydrated conditions, concentrated urine need to be excreted, and who is going to do that job for you? It is the juxtamedullary nephrons. Please concentrate. Juxtamedullary nephrons are the ones which concentrates the urine. Okay. Now, what is the other difference? Cortical nephrons, they are surrounded by the peritubular capillaries. So, for example, if you imagine this is a nephron and cortical nephron, see the cortical nephrons are surrounded by certain blood vessels. Those blood vessels should be called as peritubular capillaries, and in the same way, juxtamedullary nephrons are also surrounded by the capillaries or blood vessels. Now, these blood vessels which are surrounding the juxtamedullary nephrons, those blood vessels are known as vasa recta. Okay, so the direct MCQ is vasa recta is present in which type of nephrons? Juxtamedullary nephrons. Okay, so please concentrate. Vasa recta is something present in the juxtamedullary nephrons. Now, what is the third difference? Cortical nephrons are having very small loop of Henle. If you look here, this is a cortical nephron. It's having a very small loop of Henle, and that too, this loop of Henle is not even going into the medulla. But please concentrate on a juxtamedullary nephron for the process of concentration of urine. This loop of Henle is going deep down into the medulla. So this loop of Henle, ascending and descending loop of Henle, they are going deep into the medulla. So which type of nephrons are having long loop of Henle? Long loop of Henle is something which is present for juxtamedullary nephrons, and that's a very important point. Okay. So please concentrate. The loop of Henle, the hairpin bend penetrates up to the tip of the papilla. Okay, which is present in the renal pyramids. And please concentrate here in the cortical nephrons, the hairpin bend penetrates only to the outer medullary regions. So we have seen what are the two important types of nephrons and what are their importance. Now let's see what is the function of a nephron. We have already seen most of the nephrons are cortical nephrons. They are accounting almost for 80 to 85% of the number. Now, what is the function of a nephron? Simple, it is a urine formation. How they are going to achieve that? By glomerular filtration. At the level of glomerulus, filtration should happen. Plasma should be filtered, and from that plasma, waste products need to be excreted out. Okay, first glomerular filtration should happen. So, what is the function of a nephron? It is a glomerular filtration. This is the function of a nephron. Okay. Now, how much is the glomerular filtration? GFR. Per minute, how much filtration is happening? It is almost 125 ml. So, the glomerular filtration rate is 125 ml. If you calculate like that, per minute it is 125 ml. So, per day, if you calculate, it will be somewhere around 180 liters. So, your kidneys are having such a capacity, both the kidneys are having such a capacity that they can filter almost 180 liters of water per day, or I should say 180 liters of plasma per day. Okay, this is the function of nephron. Now let's see what exactly is filtration barrier. Okay, now I am just showing you the cross section at the level of glomerulus. Okay, we have seen afferent arteriole is flowing into the glomerulus. There they are getting divided into glomerular capillaries inside the Bowman's capsule, and all these glomerular capillaries again they are going to fuse and form efferent arteriole. Okay, afferent arteriole, capillaries, efferent arteriole. Now I am just showing you one such glomerular capillary. This is a capillary. Okay, inside this is the capillary. We all know capillaries are nothing but the blood vessels, and blood vessels should be lined by the endothelial cells. So you can appreciate this is an endothelial cell, and usually blood is something present over here in this area. Whatever I am just marking, this is the area where blood and plasma will be there. Okay, blood or plasma will be there. Now if you see, these endothelial cells, they are having certain gaps between them. Okay, see, these are the gaps which are present between the endothelial cell, and these gaps are known as fenestrations. So fenestrations are present in endothelial cells. Okay, the gaps between the endothelial cells are known as fenestrations. So this is one layer. Okay, so this is the first layer we are talking about. Now if you see down to the capillary, you are having this brown color area. Okay, this brown color layer or this brown color area is known as glomerular basement membrane. So on this glomerular basement membrane, these endothelial cells are sitting. Okay, so the second layer is glomerular basement membrane, and if you see down to the glomerular basement membrane, there are some other type of cells. Okay, this is the other type of this green color cell which is present over here. So this cell is known as a podocyte, which is also known as a visceral epithelial cell. A very important point, visceral epithelial cells which are present towards the side of Bowman's capsule. Okay, this is the side of the capillary. Now you are going towards the side of Bowman's capsule. Now blood from here should have to filter across these membranes, across these three layers, and should have to come into the Bowman's capsule, that Bowman's cavity. Okay, so the visceral epithelial cells, these green color cells which are present towards the Bowman's capsule, they are known as the podocytes, and these podocytes, they are having certain processes. These processes are known as foot processes. So foot processes are present for which layer? It's the podocytic layer. So podocytes are the cells which are having podocytic foot processes. Okay, now please concentrate. The filtration barrier is made up of three structures, and what are those three structures? Capillary endothelium, glomerular capillary endothelium, glomerular basement membrane, and podocytic foot processes. Now if you wish any substance to pass from here to here, that substance should have to cross all these three layers. Now let's continue further. Before continuing, I just want you to know one more important point here. Why? Because it's very greatly visible. Please concentrate on the podocytic foot processes. See, between these podocytic foot processes, also there are gaps. Okay, also there are gaps. Now these gaps are known as slit pores. So slit pores are the gaps between podocytic foot processes. Fenestrations are the gaps between the endothelial cells. Okay, now please concentrate. This is one podocytic foot process, this is the other podocytic foot process, and this is the other podocytic foot process. In between them, are you able to appreciate this green color line? This green color line which is present, that protein, it's actually a protein which is known as a slit diaphragm. So this protein is known as a slit diaphragm, and that's very important protein. It helps in prevention of loss of proteins. For example, there are certain glomerular pathologies where this protein is lost. If slit diaphragm is lost, what happens? Proteins can easily leak, and those proteins can be lost in the urine, leading to proteinuria. So slit diaphragm is a very important protein which is present between the podocytic foot processes. Slit pores are the gaps between the podocytic foot processes, and fenestrations are the gaps which are present in the endothelial cells. Okay, now let's continue. If you ask me, sir, what is the normal size of particles that are easily filtered? For example, here is the plasma. Usually plasma with all the blood cells will be present over here. Now it have to cross all this layer and it have to come into the Bowman's capsule. For example, please look here. Here is the normal plasma will be. Okay, this is the area where normal plasma will be there. Now if I zoom it out, see, this is the endothelial layer, the topmost. Here is the blood. Okay, this is the capillary lumen. In the capillary lumen, blood and plasma and the blood cells are there. Now the first layer, see, this layer is the endothelial layer. Now below the endothelial layer, you are having this green color layer which is glomerular basement membrane. See, GBM means glomerular basement membrane. Below glomerular basement membrane, you are having these podocytic cells. Okay, these are podocytic foot processes are there. Now fluid from here should have to come down, or the particles, the waste particles are some important substances, they have to be filtered. Now my question is, which particles are the particles of which size can be easily filtered? It's 4 to 8 nanometers. So those particles which are having a size of 4 to 8 nanometers can be easily filtered. For example, if I ask you something, a particle which is having a size of 12 nanometers or 14 nanometers or 15 nanometers, can such a particle will be easily filtered? No. So based on this, can I say that glomerular filtration barrier, these three layers, can I say that this GBM or glomerular filtration barrier is a size barrier or not? Yes, it's a size barrier. It only allows substances which are in a size of 4 to 8 nanometers. Any substance which is above 8 nanometers cannot be filtered. Okay, so glomerular basement membrane is a size barrier. After seeing this, let's just recap. So the gaps between the endothelial capillaries are known as fenestrations and the gaps between podocytes are known as slate pores. We have seen this. Now, let's talk about glomerular filtration. I have already said you that glomerular filtration is a size barrier. Only the size of 4 to 8 nanometers are freely filtered. But now, let's see one more new concept. What is that? Glomerular filtration barrier is not only a size barrier but also charge barrier. What does I mean by? Now, this glomerular filtration membrane, it allows free filtration of positively charged particles as well as neutral particles. But if a substance is negatively charged, means those substances are not freely filtered. Again I am repeating, if a particle or if a substance, if it is having a negative charge, then those negatively charged particles are not filtered. Why? If you ask me why. Sir, please look at this. Imagine that this is a glomerular basement membrane. Okay, endothelial layer, glomerular basement membrane, and below you are going to have the podocytic food processes. See, this is a glomerular basement membrane. Actually, this GBM, it's having negative charge. So, negative charge will repel negative charge. So, negatively charged particles, if they come near to the glomerular basement membrane, they will be repelled. So, they are not going to be filtered. Okay, so glomerular basement membrane is a charge barrier and negatively charged substances are not filtered. Now, let's continue. Glomerular basement membrane, I have already said you, it's a negatively charged particle. It's a negatively charged substance. Now, if you ask me why it is negatively charged, sir, the negative charge is because of certain important proteins. Which proteins? Glycoproteins, heparan sulfate. This is very important. Because of the presence of heparan sulfate in the glomerular basement membrane, it is getting the negative charge. So, the negative charge is due to glycoproteins, heparan sulfate and xyloproteins. Let's continue. What are the substances which are not filtered? Okay, see, plasma is getting freely filtered, but remember, for your entire life, RBCs, WBCs, platelets, plasma proteins, the coagulation proteins, complement proteins, they are not filtered. All the cells and the proteins, see, in the blood what you are having? You will be having mainly cells, RBCs, WBCs, platelets. So, these cells are not filtered. During any point of time in a healthy individual, they are not filtered. And the same way, in your plasma, you are having the plasma proteins, right? Albumin, globulin, fibrinogen, okay, coagulating proteins, complement proteins. These proteins are also not filtered. Okay, they are not filtered. So, these are important points. Now, here one important concept is there. See, albumin, which is a major plasma protein in your body. See, this albumin is actually a very small substance. Okay, for its size, it should be filtered. But why it is not getting filtered? Because though albumin is small, yes, it's small, there is no doubt. But it is having a negative charge. So, the moment it comes near to the glomerular basement membrane, it can easily filter. But as it's having negatively charged, it will be easily repelled and albumin is not going to be seen in the urine. For example, imagine a condition where the glomerular basement membrane is losing its negative charge. Imagine something like that. Glomerular basement membrane is losing negative charge. Then what will happen now? Now this albumin, which is very small in size, now it can be easily filtered. Why? Because GBM lost its negative charge. Now it cannot repel this albumin. Now albumin is going to appear in the urine, leading to albuminuria. So important concept, albumin small in size but negative in charge. So that's the reason why it's not getting filtered. If GBM loses its negative charge, then albumin will start to appear inside the urine. Now, just think and say, what's happening with the glucose and amino acids? Glucose and amino acids, are they going to be filtered or not? Yes, they are absolutely filtered. They are very small substances. Glucose and amino acids, they are filtered, but are they important substances or not for us? Yeah, they are metabolically very important substances. We are not supposed to lose them. Okay, because from the glucose and amino acids, like everything is going to happen in the body. From the glucose, ATP is getting synthesized. So we are not supposed to lose these important substances. So what happens? Yes, filtration will happen, but these substances 100 out of 100% will be again reabsorbed back into the systemic circulation. Okay, so glucose and amino acids, yes, they are freely filtered, but they are 100% reabsorbed. Only waste products will be excreted out in the urine. Now, let's talk a few important points about the slit diaphragm. Where we have discussed, yes, the slit diaphragm is something which is present between the podocytic food processes. They help in prevention of proteinuria. Now, see guys, slit diaphragm is something present between the podocytic food processes. So this green color line, this green color protein. Actually, this one protein is made up of many substances, something like podocin. So podocin, nephrin, alpha actinin, PRPC6. See, all these are the substances they are forming. Okay, all these are the components of our slit diaphragm. Our slit diaphragm is something made up of podocin, nephrin, alpha actinin 4. Now, if you have any problem with podocin, for example, or if you have any problem with nephrin or alpha actinin 4, then what happened? This slit diaphragm cannot function properly. If it's not functioning properly, that can lead to proteinuria. Now, we will see such a clinical condition. Now, there is this one gene known as NPHS1 gene. There are certain disorders or conditions where this NPHS1 gene is mutated. If this NPHS1 gene is mutated, then nephrin will be damaged. Whenever you are having a damaged nephrin, slit diaphragm cannot function properly. That will lead to loss of protein in the urine. How much loss of protein in the urine? Massive protein loss. More than 3.5 grams of protein per day is losing in the urine. Such a condition is called as nephrotic syndrome. So what exactly is nephrotic syndrome, sir? Nephrotic syndromes means those clinical conditions where the protein loss, proteinuria is happening. Proteins are getting lost in the urine. How much protein loss? More than 3.5 grams of protein are getting lost in the urine. So NPHS1 gene, if it's mutated, means nephrin is going to be affected. When nephrin is affected, that will cause nephrotic syndrome. Which type of nephrotic syndrome? Congenital, by birth itself. Congenital nephrotic syndrome of a Finnish type. And this nephrotic syndrome is actually steroid sensitive. If you give steroids to the baby, it will be well responded. So congenital nephrotic syndrome of Finnish type is due to mutation of which gene? NPHS1. Due to mutation of which protein? Nephrin. And is it steroid sensitive or steroid resistant? It is steroid sensitive. Now let's talk about NPHS2. Okay, so podocin is coded by, actually it is coded by NPHS2. Okay, so whenever there is a mutation in NPHS2, that will cause damage to podocin. Podocin will be affected. When again podocin will be affected, again protein loss will be there, and this protein loss will cause again congenital nephrotic syndrome. Now, it's going to be a different disorder because this nephrotic syndrome due to podocin mutation is not going to be steroid sensitive, but rather it is steroid resistant. So, whenever podocin is mutated, you are going to end up with steroid resistant nephrotic syndrome of childhood onset. So, direct MCQ is steroid resistant nephrotic syndrome of childhood onset is due to mutation of which gene? NPHS2. Is due to mutation of which protein? Podocin. It is steroid resistant in nature. Now, let's talk about alpha actinin 4 also. If there is mutation of alpha actinin 4, that will also lead to proteinuria and will lead to nephrotic syndrome. Which type of nephrotic syndrome, guys? It is autosomal dominant FSGS. FSGS means focal segmental glomerulosclerosis. So, autosomal dominant focal segmental glomerulosclerosis is due to mutation of alpha actinin 4, and if there is mutation of TRPC6, it will cause adult onset. Okay, it's not yet, it is adult. Adult onset FSGS. So, direct MCQs. Adult onset FSGS is due to mutation of TRPC6, and autosomal dominant FSGS is due to mutation of alpha actinin 4. Now, let's talk about a few important points about the glomerular filtration rate. See how actually the filtration is going to occur. For that, you need to know certain Starling's laws of forces. Right now, I am just showing you here this area, this red color blood vessel. It's actually nothing but a glomerular capillary. Okay, take it as a glomerular capillary. I have said you, glomerular capillary is lined by endothelial cells, and endothelial cells are the ones which are having the spaces. And what are those gaps? What are those spaces? They are nothing but the fenestrations. So these gaps which are there, these are nothing but the fenestrations. Now the down, this bowl shaped structure, whatever you are seeing, this yellow colored one, this is nothing but your Bowman's capsule. Okay, I am just showing it in a very simplistic fashion. Now let's talk about a few important forces. What are they? Inside this glomerular capillary, there is this one force which is called as, I have written it in PC. What is that? What exactly it is? It is hydrostatic pressure. Okay, so for your entire life, remember, when the fluid is staying in one single place, it's going to exert pressure on the walls. For example, simply imagine something like this. Imagine an aquarium, or imagine a tank which is full of water. You just go and make a small hole into wall of that aquarium or the tank. What happens? Immediately water will try to come out. So water is exerting pressure on the walls. All the times the static fluid, whatever is there, wherever it's there, it all the time want to come out. So the pressure exerted by this fluid on the wall, this is known as hydrostatic pressure. All the time the plasma within these capillaries want to come out. So how much is that pressure? Capillary hydrostatic pressure is 60 mmHg, and it is all the time want to come out into the Bowman's capsule. Now let's see the one more pressure which is present inside the capillaries. What is that? It is written with the letter pi. What exactly is this pressure, sir? It is osmotic pressure. What exactly is this osmotic pressure? The osmotic pressure is because of the albumin. Inside the glomerular capillaries, fluid is there, plasma proteins are there. See, these plasma proteins are just like sponge pieces. Remember something like plasma proteins, especially albumin. It's just acting as a sponge piece. It all the time want to keep the fluid towards itself. It doesn't let the fluid to move out of the capillary. Just how sponge piece behaves, if you dip into the water, it absorbs the water and keeps the water towards itself. It doesn't let the water to go out. So in the same way, because of the albumins here, you are going to have a pressure which is opposing the filtration. Now, albumin all the time want the plasma to be in the capillary. So it's a positive pressure or something like it's opposing the filtration. Yes, it's opposing the filtration. How much is that? It is 32 mmHg. Now tell me guys, who is more? Hydrostatic pressure is more when compared to osmotic pressure. Hydrostatic pressure is because of the plasma, fluid, and osmotic pressure is because of the albumin. One pressure is trying to move the plasma towards the Bowman's capsule. The other pressure, that's the osmotic pressure, all the time want the plasma to be in the capillary. Now, let's talk about two other forces which are present in the Bowman's capsule. Even in Bowman's capsule, some fluid will be there, right? Now, this fluid all the time want to go into the capillary. Okay, so the hydrostatic pressure, P means hydrostatic pressure. Hydrostatic pressure in the Bowman's capsule is acting as an opposing force. So it doesn't, it's like, it's opposing the fluid movement from the capillary into the Bowman's capsule. So how much is that? It's 18 mmHg. And do you think that in Bowman's capsule any proteins are there? Are plasma proteins leaking into the Bowman's capsule? No, plasma proteins are not leaking. So what is the plasma osmotic pressure? It's 0. So at the end of the day, how many pressures we are having? We are having 4 pressures, sir. In the capillaries, hydrostatic pressure of the capillary, osmotic pressure of the capillary, hydrostatic pressure of the Bowman's capsule, and osmotic pressure of the Bowman's capsule. Osmotic pressure of the Bowman's capsule is 0. Now, whether filtration happens or not depends on the pressure difference. Positive pressures means those pressures which are helping infiltration, and opposing forces, those forces which are not letting the filtration to happen. Now we will see. What is the formula? So formula is favoring forces minus opposing forces. We have seen what are the favoring forces. The favoring forces are hydrostatic pressure in the capillary, the hydrostatic pressure in the capillary, and osmotic pressure in the Bowman's capsule. See, this osmotic pressure in the Bowman's capsule, it wants the fluid towards itself, but anyway it's 0. Okay, you can neglect it. And what are the opposing forces? The opposing forces are hydrostatic pressure in the Bowman's capsule, and the osmotic pressure in the capillary. Now see, what is the hydrostatic pressure in the capillary? The hydrostatic pressure in the capillary is 60 mm Hg. And what is the osmotic pressure in the Bowman's capsule? We have to take it as 0. Now, what are the opposing forces? Opposing forces are hydrostatic pressure in the Bowman's capsule, which is 18, and the osmotic pressure in the capillary, that is 32. So 18 plus 32 is how much? 50. What is the hydrostatic pressure in the capillary? 60. So 60 minus 50 is, who is more? 60 is more or 50 is more? Definitely 60. Who is exactly 60? It's the hydrostatic pressure in the capillary. So hydrostatic pressure in the capillary is more. Hydrostatic pressure in the glomerular capillary is more when compared to the opposing forces. So how much more? More than 10 mm Hg. So now filtration will happen or not? Yes, filtration is happening in you and in me and in everyone. Glomerular filtration is happening with a pressure difference of 10 mm Hg. Okay, so this is filtration. Okay, glomerular filtration. Now let's see what are the markers. Okay, we have already seen. Now what is the gold standard agent for GFR estimation? It is the inulin. So inulin is the gold standard marker, but apart from inulin, you can also use creatinine and cystatin C. Creatinine is the most common marker and cystatin C is the new marker. All these three, cystatin C, inulin, not insulin, inulin and creatinine, by using these substances, you can measure GFR or clearance. Now, what is the formula for GFR? Guys, for example, if you want to know GFR of a person or clearance of a particular substance, the formula repeatedly asked MCQ in your exams is UV by P. Simple, UV by P. What exactly U? U is urinary concentration. It's a urinary concentration of that particular substance. V means urine output. Okay, how much urine is getting produced. And PS means plasma concentration of that particular substance. So UV by P. Now with this, let's take an example. See, in this question, urine flow rate of a patient is 2 ml per minute. See, urine flow rate, urine production, it's a 2 ml per minute. What they are asking you, what is the clearance? We have already know the clearance and GFR formula. What is the clearance and GFR formula? Let's write here. Clearance or GFR is equal to UV by P. Now let's continue the question. What is the clearance of a substance whose plasma concentration is 10 mg per ml and urine concentration is 100 mg per ml? So with this, what is the urinary concentration, guys? Urinary concentration is 100 mg per ml into what is the volume of urine getting produced? 2 ml per minute by what is the plasma concentration? Plasma concentration is 10. Okay, this is the plasma concentration by 10. So 200 divided by 10. How much it will be? 20. So GFR in this particular person is 20 ml per minute. What is the normal GFR? 120 ml per minute. In this condition, GFR is drastically falling. Okay. So this is how the questions will be asked on GFR calculation. Now let's see how GFR will be affected in different conditions. I have already said you the blood vessel which is bringing the blood towards the capillaries is known as afferent arteriole. Afferent arteriole is the one which brings the blood towards the glomerulus, and efferent arteriole is the one which takes out the blood away from the glomerulus or Bowman's capsule. Now please concentrate. If I tell you certain substances, for example norepinephrine and prostaglandins, this norepinephrine and prostaglandins, these substances, they are going to act on the afferent arteriole. How they are going to act, we will discuss in a few minutes. But norepinephrine and prostaglandins are those substances, they are acting on the afferent arteriole. And if I say angiotensin 2 is something acting on the efferent arteriole. Okay. Now let's see. For example, if I am using norepinephrine, if someone comes to you and asks you, if norepinephrine is there, or if you inject norepinephrine into some person, what will happen to GFR? How GFR is going to be affected? Norepinephrine and substances like adenosine. Okay, norepinephrine and substances like adenosine, they are acting on afferent arteriole and they will cause afferent arteriolar constriction. Norepinephrine, adenosine will cause afferent arteriole constriction. Now what happened to the GFR? Whenever afferent arteriole is constricted, what happens? More blood is coming here or less blood is coming here? Definitely less blood will be coming there. So if there is less blood over that area, what happens? Filtration will also definitely going to decrease. So automatically GFR will be decreased. So afferent arteriolar constriction, if you constrict the afferent arterioles, GFR will be decreased. Which substances will cause afferent arteriolar constriction? Norepinephrine and adenosine. Now let's talk about prostaglandins. Now what these prostaglandins are going to do? I have already said you prostaglandins are going to act on the afferent arteriole. If you give prostaglandins, they will cause afferent arteriolar dilation. So prostaglandins anywhere in the body, we know they will cause vasodilation. Here also prostaglandins are causing afferent arteriolar dilation. If that happens, what happens? More blood is going to come to the area of glomerulus, into the glomerular capillaries. If more blood is there, definitely more filtration will happen. So with afferent arteriolar dilation, what will happen? GFR will be increased. Okay, keep that point in your mind. Now let's talk one more condition where efferent arteriole is constricted. If efferent arteriole means the outflow path. If efferent arteriole, if it is constricted, what will happen? So efferent arteriole is constricted with the help of a substance called as angiotensin 2. If angiotensin 2, if it acts on efferent arteriole is going to be constricted. So what happens? All the fluid, whatever is coming over this area, this fluid doesn't have any place to go out. All the fluid is going to accumulate over here. When fluid is accumulating in this area, or I should say when the plasma is accumulating in the glomerular capillaries, they will generate more pressure. Initially they will generate more pressure, so more filtration will happen because blood doesn't have any way to go out. So here more filtration will happen. So initially if you constrict efferent arterioles, what will happen? GFR will be increased. But as time passes by, whenever there is more pressure in this area, blood flow coming to this area will also be decreased. So what happens? Later part, GFR will be decreased. So if someone comes to you and asks you, efferent arteriolar constriction will cause increase in GFR or decrease in GFR? Initially GFR will be increased, but later GFR will be decreased. So this type of response is known as biphasic response. So biphasic response is seen in efferent arteriolar constriction. And who is going to constrict efferent arteriole? Angiotensin 2. Okay. Now let's talk about some important points about the mesangial cells. How mesangial cells can alter the GFR changes. Now guys, these are the glomerular capillaries. I am just showing you the cross section of the Bowman's capsule. If I do the cross section of Bowman's capsule, inside the Bowman's capsule, who are they? Inside the Bowman's capsule, I should say inside the glomerulus, you are having these capillaries, glomerular capillaries are there. So these are nothing but your glomerular capillaries. Now inside the glomerular capillaries, plasma is there, it's coming there. Now those cells which are present, all these green color cells and yellow color cells, whatever are there here, so this area is known as mesangium, and inside the mesangium you are having certain cells called as mesangial cells. Okay, they are the connective tissue cells, mesangial cells. Now important point is, see, these mesangial cells, they are having certain contractile proteins and they can constrict these capillaries, and sometimes they can simply dilate those capillaries. Now constriction, or I should say contraction and relaxation of mesangial cells can alter the GFR. How, sir? For example, see, in this condition, first let's take a condition of mesangial cell contraction. If mesangial cells are contracted, if the surrounding mesangial cells, if they are contracted, they can cause constriction of the glomerular capillaries. If glomerular capillaries are constricted, the blood flow within them will be decreased, so GFR will be decreased. So contraction of the mesangial cell will decrease the GFR. Now comes the question, sir, why the mesangial cells are getting contracted? Which substances can cause contraction of the mesangial cells? Mesangial cell contraction is because of the endothelin and angiotensin 2. Okay, endothelin and angiotensin 2, these two substances can cause contraction of the mesangial cells and decreases the GFR. And opposite is very much easy. Now if you cause relaxation of the mesangial cells, when mesangial cells surrounding these capillaries, whenever they are relaxed, what happens? Now these capillaries will be dilated and more blood is passing through these capillaries, so more GFR will be there. So mesangial cell relaxation will increase the GFR. And which substances will cause mesangial cell relaxation? Atrial natriuretic peptide and nitric oxide. Guys, ethyl natriuretic peptide and nitric oxide, they will cause mesangial cell relaxation and increases the GFR. Okay, so in this video we have seen some important concepts about the GFR and changes in the GFR, and let's continue in the next topic.